Colon cancer, also known as colorectal cancer, is one of the most commonly diagnosed cancers and a leading cause of cancer deaths worldwide. It begins in the colon or rectum when healthy cells become abnormal and divide uncontrollably, forming a tumor mass. Detecting colon cancer in its early stages greatly improves the chances for successful treatment and a cure. That's why it's critical to know the potential early warning signs. 1. Changes in bowel habits. Changes in your normal bowel habits are one of the most common early signs of colon cancer. This can include episodes of diarrhea that come and go, constipation that persists for longer than normal, feeling like you still need to pass stool even after going, or changes in the caliber and shape of your stools. For example, you may notice your stools are coming out very narrow, thin, or ribbon-like. You might also experience bowel incontinence, where you leak stool unexpectedly. These symptoms often start gradually and tend to fluctuate day to day. Pay close attention if your bowel habits change over a few weeks. Frequently needing to strain to pass stool or experiencing bouts of constipation followed by diarrhea can signal a problem. Don't wait to get evaluated if your bowel habits don't return to normal. 2. Rectal bleeding. One of the most alarming signs is noticing blood in your stool or toilet paper after wiping. The blood is usually bright red. Sometimes the blood can be darker red and mixed thoroughly into the stool, making it appear tarry or black. You may also experience bleeding from your rectum, often accompanying a bowel movement. Any rectal bleeding should prompt an urgent trip to the doctor. While hemorrhoids can cause rectal bleeding, they could also indicate cancer or polyps. A doctor can do tests to determine the cause, such as a fecal occult blood test to detect hidden blood in stool. Don't wait to check out rectal bleeding. 3. Incomplete bowel emptying. Feeling like your bowel doesn't empty completely after using the restroom is called tenesmus. You may frequently feel the urge to pass more stool immediately after having a bowel movement. Other signs are the need to poop, but being unable to, passing only mucus or gas, and cramping without relief after using the restroom. It can feel like you can never fully eliminate everything. These symptoms suggest a possible blockage from a cancerous mass in the rectum or colon, preventing waste from fully evacuating. Don't dismiss this feeling of incomplete emptying. Talk to your doctor. 4. Thinner stools. Monitor the caliber and shape of your stools. Signs to look out for are stools that are significantly thinner than normal, often described as pencil thin. Having to strain excessively while passing stool also indicates narrowed and ribbon-like stools. A healthy stool is generally 1 to 2 inches thick. Thin stools the size of a pencil point to potential tumor growth, narrowing the colon passageway. Passing narrower, thinner stools consistently rather than occasionally necessitates prompt medical assessment. 5. Unexplained weight loss. Losing weight without effort or any change in diet can be an ominous sign. Rapid and unintentional weight loss of 10 pounds or more may indicate an underlying cancer. Make sure to monitor your weight regularly. Any significant drop needs evaluation, especially if accompanied by loss of appetite or inability to eat much. Weight loss with colon cancer stems from abnormal metabolic changes as the body tries to fight the cancer tumor. See your doctor if you notice pants becoming looser or realize you've made several belt loops without extra exercise or diet. 6. Persistent abdominal discomfort. Ongoing gas, bloating, fullness, or cramps in your abdomen can be an early red flag. You may feel discomfort, pressure, mild pain, or aches around your belly area that come and go but never fully go away. The symptoms may be subtle and easily dismissed because they aren't severe pain. However, any persistent or chronic abdominal discomfort, even mild, needs medical evaluation. This can be a sign of a tumor growing in the bowel, affecting digestion and causing gas and indigestion. Don't assume it's just something you ate if the discomfort is frequent or lasts weeks. Keep track of symptoms and talk to your doctor. 7. Weakness and fatigue. Unexplained chronic fatigue is a common symptom of colon cancer. You may feel abnormally drained, weak, or tired all the time. The fatigue can come on gradually and persist throughout the day. You'll have very low energy levels and feel exhausted even after resting or a good night's sleep. This severe fatigue is usually due to anemia, a low red blood cell count, resulting from bleeding in the colon. Make an appointment with your doctor if fatigue affects your quality of life. Get checked for anemia and have your hemoglobin levels tested. The bleeding can be mild and build up slowly over time, so it's important to catch it early. 8. Abdominal pain with nausea, vomiting. Some people with colon cancer experience periodic cramping along with nausea and vomiting. The abdominal pain is usually mild, but the nausea can intensify. You may also have bouts of vomiting along with upset stomach and cramps. Since the symptoms come and go, it's easy to blame a virus or food poisoning. But recurrent nausea and vomiting paired with any abdominal pain warrants seeing a doctor for evaluation. Keep track of frequency and severity so your doctor can discern if it's consistent with cancer. 9. Family history. If you have a first-degree blood relative, parent, sibling, child, with colon cancer, your risk is exponentially higher. You also have an increased risk if you have family members who've had precancerous polyps removed or a family history of inflammatory bowel disease. Talk to your doctor about screening options. People with a family history of colon cancer or polyps should start getting screened earlier and more frequently. Knowing your family history can help prevent the development of cancer. If you notice any potential early signs of colon cancer, don't ignore them or put off seeing a doctor. Persistent symptoms require timely evaluation. Colon cancer is highly treatable when identified early before it spreads. Pay attention to the subtle cues your body provides. Getting prompt medical care offers the best hope. I hope you found this video on colon cancer signs informative. Please like this video to help others find it. Share it with family and friends over 50 to spread awareness. Early detection saves lives. Also, subscribe and click the notification bell to avoid missing any upcoming health videos. Finally, comment below with your thoughts and stories. Engaging with the comments helps YouTube share this video further. Thanks for watching.